All right, 8 minutes past 10 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. Glad to know that you're still there tuned into this dial. Thank you very, very much for choosing Women Radio WFM 91.7. Today is Friday, day 8 in the month of November 2024. How are you doing today? I really do hope that your morning started off for you on a great note. And I also hope that you're doing your very best to stay healthy, because the cost of good health now is very expensive. It is high. If you fall sick, before you get better, you will spend so much. So try as much as possible to keep yourself safe. Do all that you can to take care of your body, your soul, and your spirit. My name is Blessing Ajayi. Welcome on Radio Doctor. Radio Doctor is a free health consultation program where medical doctors consult for free and advise on women radio. Radio Doctor is Nigeria's specialized radio health program where medical doctors advise you based on your health. And of course, it is broadcast from 10 a.m. through to 11 a.m. Mondays through to Fridays. Today on the show, our radio doctor is Dr. Abiola Ajayi, the MD of RA Specialist Hospital. Good morning, Dr. Abiola, and how are you doing today?
Good morning, Doctor. I'm doing very well.
All right, good to have you on the show for today. On today's edition of Radio Doctor, we will be talking about nutrition and pregnancy, how antenatal classes guide expecting mothers. This is more like a continuation from the program, from the conversation we had last week. Remember, we already had conversation about antenatal classes and what you should know. So now we're going to talk about nutrition and pregnancy. The phone lines are open. You can call us on 07000 917 917 or 7000 917. Send us a text and a WhatsApp message on 0703 175 6537 or 703 175 6537. That is how you can be a part of the conversation. If you are a woman, you can call our toll-free line 0800 1235 917 0800 1235 917. That is how you can be a part of the conversation for today. You can also send us a text message or WhatsApp message really, on 0703 175 6537 0703 175 6537. That is how you can be a part of the conversation for today. Once again, my name is Blessing Ajayi, and our radio doctor for today is Dr. Abiola Ajayi, the MD of RA Specialist Hospital. Dr. Abiola, I would like us to start the conversation this way. Can you start by explaining to us the importance of nutrition during pregnancy and particularly how it impacts the health of both the mother and the child?
Yes, I'm happy we're doing this topic. Like you mentioned before, it's a continuation of antenatal classes to dive more deeply into nutrition. And I want to touch on something you said at the beginning of your intro. You said that, I don't know how you put it, but you talk about the mind, body, and spirit all needing to be healthy for you to have good health.
Yes.
And that's more true than you may realize. Your mind, your body, your mood controls your cells at the cellular level. So they've done so many studies showing, they use what they call electron microscope to look at the cells, particular cells of different human beings, and they do different tests to assess their mood. And they'll assess happy, sad, depressed, anxious, and all of them express different cellular proteins, meaning that their DNA was changing, their genes were changing, their cells were changing just based on their outlook on life. The same is true with nutrition. It goes all the way down to the microscopic level. So all of these things are crucial. They're more important, to be honest, nowadays, I feel like nutrition, your mental health, and your mood are sometimes even more important than the drugs some doctors may prescribe. So, but let's answer your question. You asked about the importance of nutrition, right, and how it impacts the mother and the baby. Mm-hmm. I like statistics. In the worldwide, maternal or the mother's malnutrition accounts for over 10% of diseases in pregnancy. And in Nigeria, about 30% of newborns that die are associated with maternal undernutrition, meaning that the mother has fewer calories or fewer vitamins and minerals than are needed, and that's associated with 30% of deaths. When you look at pregnant women in Nigeria as well, anemia, which is low blood level, typically caused by iron deficiency, which is another mineral deficiency, that affects almost 60% of pregnant women. And the reason why all these deficiencies are important is because complications like preterm birth, low birth weight, even birth defects are also are all increased when you have undernutrition, malnutrition, or poor nutrition. So the studies show that if you have adequate nutrition, you can reduce the risk of birth defects by over 25%. And one thing to notice is that the mother's nutritional status while pregnant not only affects her, affects the baby, it also affects the next generation. So a mother that had poor nutrition, that developed gestational diabetes, can have a child that's diabetic, and it increases the chance of the next child also being diabetic. So they can't underestimate how important truly nutrition during pregnancy is.
All right, thank you very much for your thoughts on the show for today. 07000917917. That is the number to call to be a part of the conversation. Send us a text on a WhatsApp message on 0703-175-6537. Log into our website at www.wfm917.com. Download the mobile app, the WFM 917. Send your thoughts to our social media platforms, WFM 917. That is how you can be a part of the conversation for today. All right, Dr. Abiola, let's talk for a minute about the key nutrients that expectant mothers should focus on and why are they essential? Because earlier in the show you said something about iron deficiency in mothers and all of that. So what are some of the key nutrients that expecting mothers should focus on, and why are these nutrients essential?
Yeah, some of the key nutrients include one that most people have heard about, folic acid, and another one, iron, which we talked about just a minute ago, and proteins. I used to recommend calcium all the time, but I've stopped recommending people supplement calcium, in like vitamin supplements.
I remember you said something about calcium the other time, that if it is too much, it can be dangerous.
Yes, it can lead to a lot of the calcium forms that we take orally, that come not from food but come from tablets.
Medications.
They don't really get incorporated into the bone like we think. It gets incorporated into the blood vessels and makes them stiff, and that can lead to high blood pressure, atherosclerosis, and coronary artery disease. So I prefer people get their calcium from their diet, and especially proteins and or dairy products. But the key nutrients, folic acid, iron, and your proteins are extremely important. When you look at folic acid is especially important in the first trimester to prevent something called neural tube defects. Now, if anybody has ever seen somebody with a cleft lip or a cleft palate, where it looks like the upper lip didn't fuse, not even just the lip and the jaw didn't fuse properly, or the lower one didn't fuse properly, a lot of those stem from folic acid deficiency. And studies in Nigeria show that less than 30% of women take enough folic acid. The next one we mentioned, iron. Iron is extremely important. We talked about it as the basis for blood level, or PCV as we know. In the U.S. we call it hemoglobin or hematocrit. But 50% of maternal deaths in developing countries are linked to iron deficiency. That's 50% of deaths of the mother. So that's extremely important. And iron is used for oxygen transport. So now we can touch on calcium. Calcium, of course, we know supports bone and teeth development, but you can get that from your diet. And we'll talk more about specific dietary additions. Then there it can also help reduce infant mortality and low birth weight by almost 1/3. So all of these are extremely important. And there are a few other minerals, but we would like to touch on the most important: folic acid, iron, and proteins.
Okay. All right, and thank you very, very much. Now let's talk about how the antenatal classes help mothers understand their nutritional needs throughout pregnancies. Did I get enlightening about all of these things that you've mentioned? Because, I mean, talking about how important the calcium is and how important it is to get the calcium from the diets we take, not from the medication or the tablets or the syrup, as the case may be. So how do antenatal classes help mothers to understand their nutritional needs throughout pregnancy?
Yeah, and most antenatal classes is going to provide guidance on necessary nutrients and portion sizes, empowering mothers to make healthier dietary choices. I love research and I love statistics because it lets us know, how much more work we have to do when we're educating the public. And in Nigeria, the data shows that only 40% of pregnant women are even getting adequate nutritional education. And it's been shown that with proper antenatal guidance and proper nutritional education, mothers can reduce the risk of low birth weight by 1/3 and reduce the risk of premature birth by 1/5, by 1 in 5 or 20%. So understanding these dietary requirements can enhance both the mother and the baby's outcome. I want to say a myth or a common misconception, something that irks me, that disturbs me at this point, where most pregnant women believe they're eating for two. Have you ever heard that before?
No, please.
Most pregnant women say, "Oh, I'm eating for two," or their grandmother would say, "Eat as much as you want because you're eating for two."
Oh, yeah.
You're eating for the mother and the baby. And it's disturbing because in the first trimester, let's say first trimester is first 12 weeks. Let's say around somewhere between week 4 and week 8, that baby is about 2.5 centimeters. That's the width of a man's thumb, right? That's the size. So can you imagine eating the same amount of calories for your large body as something that's the size of your thumb? And in fact, during the first 12 weeks, you do not need to add any calories to your diet. If for most people that are eating adequate calories, they're not gaining weight, they're not losing weight. So for those first 12 weeks, you do not need to add anything additional. Your normal dietary intake or caloric intake is probably fine. In the second trimester, you typically are supposed to add about 350 calories a day. With 2 glasses of low-fat milk is 300 calories, right? So 350 calories is about a donut. I don't tell people to eat donuts. That's bad food, but it's not that much. And in the third trimester, or the final trimester, you're adding about 4 to 450 calories a day. That's probably about 6 to 8 pieces of plantain, right? So that's all that you need to add, and baby will develop properly. Instead of looking at the quantity of food you eat, the quality of food you eat, and the nutritional density of food you eat is far more important than just eating quantity.
All right, thank you very much. 07000 917 917. That is the number to call to be a part of the conversation for today. 07000 917 917. Send us a text and WhatsApp message on 0703 175 6537. Log into our website www.thebfm917.com. Download the mobile app, the BFM 917. Send your thoughts to our social media platforms, WFM 917. And as if you're just joining us, you're listening to Radio Doctor. Radio Doctor is your free healthcare conversation program where medical doctors advise real people. And of course, my name is Blessing Ajayi, and our doctor for today is Dr. Ajayi, the MDC of RA Specialist Hospital. And today on the show, we're talking about nutrition and pregnancy, how antenatal classes guide expectant mothers. So if you're a woman and you feel like, you want to call in, you don't have enough recharge on your phone, you can call our toll-free line 0800 1235 917. 0800 1235 917. That is how you can be a part of the conversation for today. Dr. Abiola has established so many things on the show, particularly about the importance of nutrition in our diet as pregnant women, as you know, how important it is for us to get all of these nutrients from the food we eat, and of course how important it is for you to take your folic acid, your vitamins and all of that. All right, Dr. Abiola, it is often assumed that antenatal classes are only beneficial in the later stages of pregnancy. When is the best time to start and why?
Start antenatal classes early. Ideally, in the first trimester is crucial. You know, last week I talked about the recommendation based on, let's say, the World Health Organization is starting in the the 20th week, but I prefer to start in the first trimester because early nutritional education is linked to a 25% reduction in preterm birth, 40% lower risk of neurotube defects like the cleft lip and the cleft palate. And according to even Nigeria's Federal Ministry of Health, early counseling significantly decreases the chances of malnutrition in pregnancy. So I like to tell people, as soon as you've confirmed your pregnancy and you've done all your antenatal tests, your urine and your blood, start enrolling for the classes. The classes should be part of your antenatal package anyway, so it's not that you're paying additional for them. And it's, at least in ROA, nobody kicks you out if you want to start the first week or you want to start the last week. But the earlier you start, the better.
The earlier, the better. All right.
6 to 12 weeks. If
Now,
you're looking for a number between 6 to 12 weeks, you should definitely have started.
6 to 12 weeks, you should definitely start your antenatal. All right. Thank you. That is very, very, very it's very straightforward that way. So it's not about being early, but you should know that within the 6 to 12 weeks you should actually start. Thank you very much for that, Dr. Abiola. Now, can you give us examples of foods that are beneficial for pregnant women, and why would you recommend such foods?
Yeah, there's some beneficial foods like beans, leafy greens. And when I say beans, if you eat beans and you struggle with ulcer, reflux, or heartburn, then please don't eat beans. But there are many beneficial beans, leafy greens. When they talk about leafy greens, talking about the deep green leaves like salads, ugu, ewedu, those kind of things. Eggs are also fine, and then occasionally yams. Why are beans important? Beans are rich in protein and fiber. Both are essential for growth and the health of your digestive tract. Then leafy greens like ugu provide iron, which helps reduce the anemia risk. We mentioned 60% of pregnant women in Nigeria have anemia. So eating things like ugu, ewedu, lettuce, salad, with ugu's pumpkin leaves, all of those things help provide essential iron. And then eggs provide protein as well as something called choline, which helps support brain development. I don't like eating a lot of carbohydrates, but a small amount of yams, which I usually say about 4 to 6 tablespoons, provides vitamin B6, which helps reduce nausea in early pregnancy. So small amounts of it are fine. And it can reduce nausea by up to 70%. I think we talked about it last week, nausea and vomiting of pregnancy, where women may be nauseated, especially in that first trimester. So some studies show that eating a little bit of yam may help reduce your nausea.
All right, 07000 917 917. That is the number to call to be a part of the conversation for today. So let's talk about the antenatal classes. I know you've mentioned some of these foods that are very healthy and beneficial for pregnant women. However, how can antenatal classes help expecting mothers make healthier food choices within their budgets?
Antenatal classes at times can include budgeting strategies, but we like to focus on locally sourced foods. You mentioned it earlier in your intro as well, that eating healthier or making healthier food choices may be more expensive. But as we commonly say, health is wealth.
Yes.
And at the end of the day, spending more on the healthier food choices is going to save you exponentially more or a lot more as opposed to treating chronic disease. Right? So, for instance, Nigerian foods like beans, okra, and spinach are nutrient dense and they're economical. Right? So your beans have your protein, they have fiber. Your spinach or your okra have your iron and more fiber. So those are not expensive, not too expensive, and they're great. Educating mothers on meal planning can help reduce food costs by almost 15%, while also improving their nutritional intake. And you mention that it's always better for your body to get these nutritional supplements or these vitamins and minerals from the food you eat, not from just the supplements.
All right, and thank you very much for your thoughts on the show for today. 07000-917-917. That is the number to call to be a part of the conversation. Send us a text and WhatsApp message on 0703-175-6537. Log into our website, www.thebfm917.com. Download the mobile app, the BFM 917. Send your thoughts to our social media platforms. WFM 917. This is 10:30 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. If you are just joining us, you're listening to Radio Doctor. Radio Doctor is a free house consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized radio house program where medical doctors consult for free and advise on your women radio. Radio Doctor is broadcast from 10 a.m. through to 11 a.m. Mondays through to Fridays. My name is Blessing Agboita, and Radio Doctor for today is Dr. Abiola Ajayi, the NDCU of ROA Specialist Hospital. And today on the show, we're talking about nutrition and pregnancy, how antenatal classes guide expecting mothers. You can call us on 07000-917-917. That is how you can be a part of the conversation. Send us a text and WhatsApp message on 0703-175-6537. Log into our website www.thebfm917.com. Download the mobile app, the BFM 917. Send your thoughts to our social media platforms, the BFM 917. That is how you can be a part of the conversation for today. My name is Blessing Agboita. Now, Dr. Abiola, are there any specific dietary adjustments pregnant women should make in each trimester?
Yeah, so that's what I was touching on, and I'll like to go over it again. Yes, dietary changes need to change trimester to trimester. In the first trimester, folic acid is critical to prevent these neuro2 defects. It can also reduce brain abnormalities by up to 50%. The amount of folic acid we should take that's recommended usually is 400 micrograms per day, but I like to do 800 micrograms per day, especially in the first trimester. In the second trimester, babies will need more calcium for our bones, which we're going to get from our diet, and as well as iron, as the baby's bones and red blood cells are developing very fast. And if for our listeners, our red blood cells are made in our bones, right? So important. The role of calcium and iron in bone development and red blood cells is cannot be overstated. In the third trimester, or last 12 weeks, protein and healthy fats are prioritized for brain development. So things like healthy fats are what we call monounsaturated, or where do we get these kind of healthy fats? We get them from things like avocados, eggs, to some degree, animal proteins to some degree. And you want trying to avoid things like seed oils, the canola oils, or all those kinds of things. And especially in the third trimester, that plus protein has been shown. If you look at just the number of calories, a typical woman of average height needs somewhere between 1,600 to 1,800 calories a day. That doesn't change, really need to change in the first trimester. In the second trimester, about an additional 300 calories are needed per day, and like I said before, in the third trimester, about another 400 to 450 calories are needed today. It's not much more that you're eating. A typical meal, which has small amount of carbohydrate, vegetables, and protein, can be anywhere from 500 to over 1,000 calories. So you don't have to eat even a whole meal extra. You're eating, you're eating, like I said, 6 to 8 pieces of plantain, if that's what you're doing, or 2 pieces of chicken, or 3 to 4 pieces of small beef. Additional in the entire day is all that's needed. And all the things I mentioned are high in protein as well.
All right, 070917917. So let's talk about some of the common cravings during pregnancy. Are those cravings even real? You know, somebody will wake up one day and say, I want bones jollof, I want shawarma, I want pizza, I want this. Are those cravings, are they real? Or, sometimes they are being exaggerated, and how does it even happen? And also, are there safe ways to manage them? You know what they say now, the excess of everything, too much of everything is bad. So are there ways to manage cravings when they come, and what are some of the common cravings during pregnancy?
Yeah, common cravings include sweets and salty snacks, and around 60% of Nigerian women report cravings during pregnancy. Cravings are normal. It's because of hormonal changes, right? So there's some hormonal changes that obviously accompany pregnancy, and those can drive those cravings for sweets and salty snacks. While the cravings are normal, the antenatal classes and we are teaching moderation. For instance, fruit can satisfy cravings, sweet cravings healthily, rather than cake, cookies, candy, etc. Satisfying these cravings mindfully can help prevent excessive weight gain, because excessive weight gain can increase the risk of gestational diabetes. That's diabetes that occurs in pregnancy. And once you have increased the risk of gestational diabetes, you increase the risk of your child having diabetes for 2 generations at least. So, education can give safe alternatives. I'd rather a mother eat 2 or 3 slices of pineapple than eat a large slice of chocolate cake. It's far different, the types of sugars and nutrients that you're getting. One of those meals will remove nutrients from your body. The other one will add nutrients to your body. I cannot say that more.
All right. Let's talk about this one. How do antenatal classes educate mothers on food to avoid during pregnancy, and why?
Some of the classes educate mothers on some foods. Some of the basic things where you don't want to eat unpasteurized dairy products. These are products that maybe were grown with mold. These are some types of cheeses and some types of milks. Right? You don't want to eat raw or undercooked meats. Of course, that can lead to a bacterial risk. And in pregnancy, especially in Nigeria, you're trying to avoid certain street foods, because some of these street foods can carry foodborne illnesses like something called listeriosis, caused by a bacteria, and which is associated with about 1/5 of miscarriages. So about 20% of the time, this bacteria, which can be found in food, can cause miscarriages. So education on food safety can reduce maternal infections and improve the health of the baby and the outcome of the baby significantly.
All right, 070917917. Let's talk about hydration for a moment. Can you discuss the importance of hydration during pregnancy and how it is addressed in antenatal classes?
Yeah, hydration is extremely important. I hope there's nobody listening that thinks that you can hydrate your body by drinking minerals, right? That those actually dehydrate you and pull essential vitamins and minerals out of your body. It was an excellent marketing strategy to call those things minerals, right? Because it sounds healthy, and they're anything but. Also, a lot of our juices, our fruit juices, and stuff are just so full of sugar and other other processed chemicals that they're not beneficial. It sounds like fruit juice would also be helpful or healthy, but they're not. So we're talking about hydration with water, especially. And you've heard the term. Oh, should I hold on for a second? Do you have a question?
No, it's fine.
Oh, okay. So, you've heard the common statement where people say you should drink 8 to 10 glasses of water.
Absolutely.
Especially in warmer climates. I usually tell people, make sure you drink when you're thirsty, and when you're not thirsty, you don't need to drink and I'm talking about drinking water. When you look at your urine should kind of give you an idea of your hydration status. A very good idea. So if your urine is dark and concentrated, probably means you need to drink more. And if your urine should not be white, it should be, the term is straw colored. It's a pale yellow. So if your urine is pale yellow, then more than likely you're pale yellow and you're not thirsty. More than likely you're consuming enough water. But even though they say drink 8 to 10 glasses of water a day, we're not counting the amount of water that's in your food, depending on what you eat. So if you eat a watermelon or you eat a fruit, that counts towards your water intake, right? So some studies show that dehydration alone can lead to preterm labor, and we know that preterm labor is not good for either of them. So antenatal classes may suggest hydrating foods like watermelon, cucumbers, which are both full of fluids, but also have essential electrolytes, which are beneficial for the mother.
All right. Now let's talk about the part of balanced diets. How do antenatal classes help expecting mothers to maintain a balanced diet, especially if they are dealing with nausea or aversions?
Yeah, nausea, like I said, very more pronounced in the first trimester and beginning of the second trimester. Classes provide strategies such as we recommend that our women eat small, more frequent meals, especially if you're struggling from nausea and or vomiting. You want to eat smaller meals a little bit more frequently. Then you want to incorporate bland food, less spicy foods, bland foods, and high fiber foods like wheat toast, which you don't eat too much of, but wheat toast is okay. Bananas are also okay. Tea without caffeine with lemon, ginger, those kind of things also help reduce morning sickness. And although 80% of women experience morning sickness, especially in the first trimester, if you're able to incorporate some of these strategies, you can greatly reduce it.
All right, this is 19 minutes right before 11 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. Glad to know that you're still there tuned into this dial. Thank you very much for choosing Women Radio WFM 91.7, Nigeria's first and only radio station for women and their families. If you are just joining us, this is where you should be. Please do well to send us a message or call us on 07000 917 917. Dr. Abila would gladly provide answers to your questions. If you have a question, do not hesitate to reach out. Dr. Abiola is here for you. Okay, so Dr. Abiola, we have this message. This one says, "Good morning, doctor. I am Stella from Ikeja. My question is, I lost 2 pregnancies in the space of 1 year of my marriage. I went to the hospital and the doctor said my body is too fragile in the first 3 months of conception. What should I do about it for it not to occur again?" Over to you, Dr. Abiola.
Yeah, so, a patient complaining about recurrent miscarriage. It's possible what advice she was told. I would more likely say that if you're losing, she says she lost 2 pregnancies in the space of 1 year. That's painful and that's difficult to deal with. I would like to know when those pregnancies were lost. Were they lost in the first 12 weeks? Were they lost in the last 12 weeks? And it makes a difference. But typically, over half of the time, these pregnancies are lost in the first 12 weeks. And over half the time, it's because of inadequate hormonal support. So when you're pregnant and as you're developing along, your body's supposed to be increasing some levels of some essential hormones. One of them is progesterone. And if some of these hormones are too low, you can have these miscarriages. But there are also other factors that can that attribute to those miscarriages, like poor DNA, poor DNA quality, which usually means poor egg quality or poor sperm quality. And if I'm going to treat somebody like this, I would bring them in, of course, ask a series of questions. I would look at the husband's sperm quality, do some basics tests on the mother, and then say, as soon as you get pregnant again, come immediately. If you find out you're pregnant on Monday, come on Tuesday. And we're now going to start you on some supplements to try and reduce the chance of that happening. So, of course, I can't name the supplements on air, but if she hears that and wants to reach out, I'm sure she'll find out. But if not, make sure you inform your healthcare professional that you're interested in that. I put people on at least three different medications and supplements to start. And we see a lot less of that when they are consistent with the supplements.
All right, Stella, I hope that helps. If you have further questions, please do not hesitate to ask on the show for today. 07000-917-917. That is the number to call to be a part of the conversation. 07000-917-917. Send us a text and WhatsApp message on 0703-175-6537. Log into our website www.wfm917.com. Download the mobile app WFM917. Send your thoughts to our social media platforms WFM917. All right, Dr. Abiola, how can partners or family members support an expecting mother's nutritional needs based on what they learn in antenatal classes?
Well, partners and family members can help with meal planning. They can help with grocery shopping.
All right, Dr. Abiola, please hold on for a moment. What do we call? Hello, good morning. Oh, we lost that call. Please do well to call us back on the show for today. All right, Dr. Abiola, please go on.
Yeah, so partners, and feel free to interrupt me, of course, when you have questions. The partners and family members can help with meal planning, grocery shopping, and helping prepare nutrient-dense foods. We talked about some nutrient-dense foods in the previous question. And, the good thing about Nigeria is that communal family support can be instrumental. And some of the studies show that women with family support are 40% more likely to follow nutritional guidelines and reduce things like low birth weight. Right? So having a support system promotes mental well-being, reduces maternal stress, and partners and family members are crucial, very crucial. But it's not just getting the woman the things she likes to eat, is getting, that's why I keep saying nutrient-dense food, so preparing things that are actually going to be beneficial, and also watching the amount of food that they're eating.
All right. 07000-917-917. That is the number to call to be a part of the conversation. Send us a text and WhatsApp message on 0703-175-6537. Log into our website www.wfm917.com. Download the mobile app WFM917. Send your thoughts to our social media platforms WFM917. Dr. Abiola, let's talk about this one. How do antenatal classes address the importance of weight management during pregnancy and its impact on both mothers and their babies? Because one of the challenges, or one of the perks that comes with pregnancy is some people tend to change weight. They increase, and some people don't even get to shed that weight after the childbirth. They deal with it even after childbirth. So how do antenatal classes address the importance of weight management during pregnancy and its impact on both mother and the baby?
Yeah, like I said, this is one of the topics, or one of the parts of this topic that are really important to me for the health of the mother, the health of the baby. I'm going to repeat it again. Poor nutritional decisions you make with this pregnancy not only affect you as a mother, affect the baby, and affects the next generation, the next child you're going to have. At the minimum, there's a chance that it can affect all your children. So there's, in the antenatal classes, we're talking about the importance of avoiding excessive weight gain. The excessive weight you gain during pregnancy is going to be that much harder to lose. And you've heard 1,000 stories where, what was it? No, I was shapely, I was fine, until I got pregnant. The baby ruined my shape. And that may not be completely true. Oftentimes, the mother ruins her shape by eating too much or gaining too much weight. Then, you don't have much drive to diet and exercise and reduce weight, especially feeding or taking care of a newborn. And so that weight just stays with you, right? And it takes a lot of work, as opposed to if you were to avoid gaining that weight, excess weight, then it'd be very easy for you to maintain a healthy weight afterwards. On top of just looking good, excessive weight gain can lead to complications like gestational diabetes, preeclampsia, which we talked about last week, which can end up with seizures and maternal death, as well as cesarean delivery. The baby, if you were getting too big, more likely your baby's getting too big, and it may be too difficult for that baby to pass through the vagina. So now you're setting yourself up for a cesarean delivery, and nobody wants that if that's not required. So in Nigeria, about 20% of pregnant women are overweight. For a country that suffers from malnutrition and undernutrition, it just shows you that portion control and balanced meals are not being promoted. Right? So that's one of the main importance of antenatal classes. Talk about portion control, balanced meals, and reducing that excessive weight gain. With that excessive weight gain, like I mentioned, gestational diabetes, preeclampsia, as well as higher birth weight, which can increase the risk of childhood obesity by 35%, just from excessive maternal weight gain. So on top of that, we like to encourage regular physical activity, walking, and things like that, which can help maintain healthy weights and reduce complications.
All right, thank you very much, Dr. Abiola, for your thoughts. I think we've said so much on the show, and I am glad that we've been able to help any pregnant woman or a woman hoping to get pregnant this morning by sharing all of the things that we've talked about, from the nutrition to antenatal classes to how family members can step in to what we need to eat, to what we need to avoid, to the things we need to pay attention to. Thank you very, very much for sharing your thoughts with us on the show for today. Just before I let you go, what would you like to say to pregnant women currently listening to you now?
Yeah, I would like to encourage women to seek, just like I do every week, seek professional attention early and seek it often, because the earlier you start focusing on things like the antenatal classes, the nutritional requirements, the better for you and the easier it's going to be for you to maintain not only a healthy weight but a healthy lifestyle. So, and if your particular healthcare provider is not really talking much about nutrition, then you need to seek some nutritional assistance, because it is extremely important. It's probably one of the most important for development of the child. So if you can't find it, then of course that's why we're here to help. And I'm sure you're going to give them all our socials and contact information. But it's been an absolute pleasure. I love this topic, and thanks for having me.
Thank you very much for being a part of the conversation today, Dr. Abiola. Well, that was Dr. Abiola Ajayi, the MD CEO of RA Specialist Hospital. And I will say thank you for today's free consultation and advice on nutrition and pregnancy, how antenatal classes guide expecting mothers. Dr. Abiola, like I said, is the MD CEO of RA Specialist Hospital. So if you would like to reach out to him for consultation, please do well to reach out to him on 0913 579 5108 0913 579 5108. You can also reach out to Dr. Abiola on any of the social media pages. Facebook, it is ROA Specialist Hospital. Instagram, it is ROA Specialist Hospital as well. And of course on YouTube, it is ROA Hospital. Twitter, it is ROA Hospital. Or better still, visit www.theroahospital.com to reach out to Dr. Abiola Bola. Many thanks to you for being a part of the conversation as well. I really do appreciate you. Let's do this again on Monday at 10 a.m. on Women Radio 91.7. Radio Doctor on Women Radio, the PFM 91.7, is Nigeria's first specialized radio house program, which is broadcast from Monday through to Friday, 10 a.m. through to 11 a.m. So join us again, like I said, and let's have an amazing time together on radio. Many thanks to the producer of the program, Aisha Sani, and of course the executive producer, Tung Okewale Shunaya. My name is Blessing Agui. To ensure you have